Good afternoon, everyone. My name is Yaozu He from Guangzhou A's People Hospital, Guangzhou, China. And today I'm honored to present our study. Before starting, we have nothing to declare for this study. Hepatitis D virus is a significant global issue, often complicating with HBV infections. Previous studies have shown that HDV infections can exacerbate the liver damages and increase the rates of cirrhosis and HCC and worsen overall prognosis. So globally, about 5% of chronic HBV will co-infect with HDV. HBV is highly prevalent in China, but HDV infections remains largely unexplored in HBV and HIV co-infection patients in China. And then our study was motivated by two primary goals. First, the limited data on HDV prevalence in individuals co-infected with HBV and HIV in China, and uncertainty about how HDV infection impacts the outcomes of ART and liver disease progression in HBV and HIV co-infected individuals. So we aim to assess HDV prevalence in HBV and HIV co-infected individuals in China, and then evaluate the impact of HDV on ART efficiency and liver disease progression. So we conduct a retrospective cohort study involving HBV and HIV co-infected individuals diagnosis between January 2005 and August 2022. And the baseline plasma samples were tested for HDV antibodies, including IgG and IgM. HDV-RMA were tested in antibodies positive case. We want to compare the demographic characteristics, liver complications, and treatment response based on HDV status. So this slide shows that the enrollment process. Initially, we screened about 2,045 individuals diagnosed in our clinic from 2005 and 2022. Patients with incomplete baseline data, acute HBV infection follow-up time less than 12 months, no sample available for serological testing were excluded. This results in 1,130 individuals for the antibodies serological tests. These patients were screening for HDV antibody tests, and 48 patients were positive. Among the HDV antibody positive patients, we identified 19 was HDV-RMA positive. This slide shows that the baseline characteristics of HDV antibody positive individuals. And as we can see from the chart, the HDV antibody patients seem to have a higher high proportion of co-infected with HCV, and we observe the higher HBV DMA levels and ALT levels, as well as API and FIC4 scores from the baseline, indicating the more severe liver inflammation. Among the HDV-RMA positive individuals, the baseline characteristics were also similar, but shows more evident signs of higher ALT, AST level, as well as API and FIC4s, indicating that the active viral replication and liver inflammation. So next, we analyze the HDV-RMA dynamics before and after ART initiations. In 19 HDV-RMA positive patients, individuals, only 14 have the longitudinal samples for further analysis. You can see that the baseline HDV-RMA was about 2.9 log international unique per milliliters. And most of them start with TTF-based ART. After the ART initiations, HDV RMA levels significantly declined. Notably, about 92.5% of individuals achieved undetectable levels after 7 years of treatment. So next, the slide shows that the treatment response and outcomes stratified by HDV status. And you can see that no difference between the treatment response, including HBV DMA suppression, HIV RMA suppressions, and the new developed liver cirrhosis and ACC between the HDV antibody positive and negative patients. And we can also see that the treatment response and outcome also similar between the HDV RMA status. This cabinet analysis shows that the new diagnosis liver cirrhosis in different groups, as we can see from the left side, and yes, there were no scientific difference between the cumulative incidence of new developed liver cirrhosis between HDV antibody positive and negative groups. And the right side shows that we know that HCV is important factors to have a negative impact on our liver disease. So when even excluding the HCV infection, we can also see the similar results. In conclusion, HCV co-infection is common in individuals co-infected with HBV and HIV in China. And HDV has a negligible effect on ART efficiencies and severe liver outcomes. So successful HBV suppressions may promote HDV controls, as indicated by substantial HDV RMA decline and virological suppressions. And the last slide, I would like to thank my mentors, Professor Lin Hua Li, and my colleagues for their contribution throughout this study. Thank you for listening.